Hello there. Welcome to my channel. I'm Dr. Perkins. I'm a board certified OBGYN, and we're here to talk about how to treat a yeast infection. In this video, we will talk about what exactly is a yeast infection. We'll talk about the different ways that we can go about treating a yeast infection. And I'll also give you some tips as far as what you can do at home to help to reduce the likelihood of getting a yeast infection. A yeast infection is truly a common occurrence, wherein up to 75% of reproductive females will experience a yeast infection at least once in her lifetime. This is a lot. That means most of us will have this issue and will need some assistance with helping to clear it. And so what is a yeast infection? Well, a yeast is a fungus. And so it's another term for a fungal infection, more specifically, a fungal infection in the vaginal space. Yes, this infection begins there. And it's easy for it to begin there because yeast normally lives in the vaginal space. The specific type of yeast or fungus is called Candida. That's Candida. So if you've gone to the doctors and they diagnose you with this problem, you will see the term candidiasis or vulval candidiasis. It means that you have a yeast infection of the vaginal area. Now, Candida normally lives in your vagina. It is supposed to be there. The yeast that lives there normally actually helps to balance and create order, I'll say, in the vaginal space. And so what I really truly mean by that is that we have bacteria and fungus that lives in the vagina, and they work together to help to protect the vaginal area from intruders. And so what do I mean by that? Well, the vaginal space is open to the world. And so what happens is that we have bacteria that can come from the anal region, bacteria that lives on the skin. We have fungus that is looking for an opportunity around the area on the outside in between our legs. And so what happens with that is they can crawl and get into the vagina. And when they do, they can cause an infection. And so our bodies and our vaginas innately have a combination of bacteria and fungus that are really there to stop the intruders. Anything that comes in that shouldn't be there, it helps to fight them, to get rid of them, so that the vaginal space remains happy, healthy, and well. And so, Candida normally lives there. Whenever we have an overgrowth of the amount of Candida that should be in the vaginal space, we then get a yeast infection. This means that you have more yeast in the area than you ought to. And so with that, we start to have symptoms such as itching. We have a change in our vaginal discharge, wherein you may have a white, thick, clumpy discharge, which is very different from what is considered to be normal, which is normally very thin and light grayish in color, not clumpy. And so if you're having the symptoms or you're having the discharge changes, it's really truly important that you see your provider and be tested. The reason why I suggest being tested first is that there are so many different things that can cause itching down there. Sometimes we can have vulvitis, which is an inflammation of the vulva or the outer lips of the vaginal area that may be caused by the tissues that you use to wipe when you go to the bathroom, or the detergent that you use to wash your clothing, or the soap that you use to wash down there. There's so many things that can cause inflammation, which will lead to itching down there. As far as discharge changes, there are also other things that can cause a change in your discharge. STDs or STIs, sexually transmitted infections, can do that, such as gonorrhea, chlamydia. You can have changes from hepatitis or HIV. Just any STI can cause a discharge change down there. Now, a clumpy discharge is specific for a yeast infection, but not all yeast infection comes with clumpy white discharge. And so if you have any changes down there, I really urge, or charge you, I should say, I charge you to see your provider and get a sample of the vaginal area so they can test if this is truly a yeast infection or not. Now, if this is confirmed, there are different options for how to treat it. The first is you can get medicine that is over the counter at a pharmacy, and it is going to be in the form of an azole. It's going to end in azole, azole. And so miconazole is the most common over-the-counter medicine that treats a vaginal yeast infection. Oftentimes we hear it as Monistat as far as the generic or the brand name, but truly when we look at the generic name, you want to look for a suppository that goes inside of the vaginal space or the vaginal canal to treat the yeast infection. And I'll show you an example of what that can look like. This is a small tube, smaller than that would be average, but this, you can't see the words here, but it says miconazole nitrate cream. This is a suppository that can go inside of the vaginal space for treatment of a yeast infection. Sometimes it is in the form of a cream like this one. And sometimes it could be like a suppository, which I'll open up for you, that is not a cream, but this almost looks like a large capsule, and it's firm, and you slide this internally in the vaginal space to treat a yeast infection. Both of these treatments are available over the counter, and you can purchase it without a prescription. They will come in a certain amount of days of treatment. So you can have a suppository that is for a 1-day treatment. You can have one for 3 days, 5 days, or 7 days. There really isn't a big difference as far as efficacy and treatment of the yeast infection. So if you use it for 7 days, it doesn't mean that that's more effective than using a 1-day treatment. Both will work just the same. The important thing is that you will complete the course based on the medicine that you bought. So if you bought a 3-day treatment, you use the medicine for 3 days. If you bought a 1-day treatment, you treat yourself once and then you're done. After treatment, with any of these suppositories, the cream or the pill, you want to wait 7 days before you assess whether or not the treatment was effective. That means don't anticipate that your symptoms will be gone after a day or two. It literally may take up to 7 days to be completely cleared and for your symptoms to completely go away. The alternative is using a pill called fluconazole. This pill is oftentimes a one-time treatment, a small, tiny pill that you take by mouth. It must be prescribed, and you take this pill and your treatment is complete. A majority of people will only need 1 pill, but a small amount of people may need 2 or 3 to complete treatment. Your doctor will prescribe this, and based on your symptoms, you can talk about whether or not you want to repeat the treatment with 2 pills versus 3. This is something that is based on whether or not your symptoms have been completely gone after 1 treatment. And this is a conversation to have with your doctors. Now, 2 different ways for you to treat a yeast infection, 1 by prescription, 1 over the counter. 2 different routes. Some people are okay with placing things vaginally, and so it's okay for them to use the treatment with a suppository. Some people hate pills and will not opt to get the pill as the treatment option. You want to pick the one that works best for you for convenience as far as what feels comfortable for you. Regardless of the option you choose, I also think that it's really important that we find the reason why a yeast infection was formed. If you have one yeast infection and it completely clears and you don't have another one, then not much to worry about. Maybe that was just a random occurrence. But if you have yeast infections over and over and over again, it's important for you to evaluate and investigate what could be causing a yeast infection for you. Sometimes it could be that you have an underlying medical condition like diabetes that is uncontrolled. Sometimes it could be that you are often in wet clothing from just swimming a lot or sweating a lot down there. Sometimes it could be that you have an excessive amount of sugar in your diet, and yeast loves sugar. And so if you find yourself having recurrent issues, it is time for you to slow down, get some pen and paper, and try to figure out what could be causing a yeast infection for you. While so many women will experience a yeast infection, it doesn't have to recur. Make changes in your life, and if you need assistance with this, I have an option to help you on this journey. If you click the link below, I have a free assessment that checks to see if your lifestyle could be causing hormonal changes that could lead to things like recurrent yeast infections. So if you're concerned and you'd love to take this free quiz, you'll find the link right below this video, and I'll be more than happy to send this over to you so we can get answers to your concerns today. Thank you so much for listening. Thank you so much for being here. I hope you learned something, and I look forward to seeing you in another video right here on my channel. Thank you for being here, and take care.